Continuing with chapter 13, we're going to look at the various drugs that hopefully will help with nausea. And the first category are known as the 5-HT3 receptor antagonists. Now, if you remember serotonin, its chemical name is 5-HT, and the 5-HT3 hit particular receptors. And they are antagonists. That means they're going to block the action of those particular serotonin receptors. I don't know if you remember back to the old days in February where we first started talking about migraines. And migraines are helped by the drugs that are serotonin receptor agonists, because a lack of serotonin can sometimes lead to headaches, but one of the side effects is nausea and vomiting, because the more serotonin you have, the more it's possible that these particular receptors are going to be irritated and result in nausea and vomiting. So this particular drug, the 5-HT3 receptor antagonist, will block those receptors and hopefully stop that nausea and vomiting. So we use this to block the 5-HT3 receptors in the GI tract and also in the chemoreceptor trigger zone. And that way, that reduces nausea and vomiting from all kinds of usually medically induced reasons: chemo, radiation to the GI tract, the anesthesia that many people seem to get after surgery, and then just the vomiting that sometimes people experience when they first wake up from surgery, especially if their GI tract has been disturbed. Now, the prototype drug is a drug you might recognize. The generic name is ondansetron, and its trade name is Zofran. And checking in our textbook, we see on the bottom of page 243 that it lists a couple of examples. You might hear of Anzamet, but Zofran is extremely common. And it started off, where I first saw it, was used for chemotherapy patients. And now it's pretty commonly used. But these drugs can cause dizziness, headache, and drowsiness as side effects. Adverse effects can be a little bit more serious, like any drug, allergic reactions, cardiac dysrhythmias, and in extreme cases, renal or liver damage. Very, very rare and usually caused by using this particular type of drug over a long period of time. Drug interactions, like everything in the world, it does not mix well with the MAOIs. Also doesn't mix well with morphine. Morphine can increase serotonin. And then our SSRIs for depression also increase the amount of serotonin available to us. And so that can kind of interfere. If you take the 5-HT3 antagonists with phenothiazines, that can cause cardiac dysrhythmias. And one example of a phenothiazine is the drug Phenergan. Phenergan is pretty commonly given for nausea and vomiting and sedation. And given those two drugs together could cause the heart to behave erratically. And once again, notice that's in red, so you probably will see that again when we can eventually test. What this means for you as the nurse, we need to warn our patients that these can cause dizziness. So there's a falls risk. You want to try to give before the vomiting starts. If you know that your patient's in a situation where they can get nauseated, you want to pre-medicate them. Watch for any other drugs that increase serotonin, like the ones we mentioned above. Usually this is given IV, especially Zofran, although Zofran can be given IM and even PO. Recently, my mom had a little GI virus, And when I picked her medicines up for her, she had PO Zofran, and they were dissolvable tablets. She just had to put them in her mouth and they dissolved. And so that kept her from having to swallow a whole lot of medications that could irritate her already irritated stomach. On page 245 in your book, you'll see patient and family teaching for the 5-HT3 receptor antagonists. And make sure you read the information about Zofran and the other drugs in the table on page 243. The next category we're going to look at is a category that I have actually never given a patient. I think they're newer. And these are known as substance P neurokinin 1 or NK1 receptor antagonists. So once again, they block certain receptors that can lead to nausea. Our prototype drug is a drug called aprepitant or Emend. And this also is listed at the bottom of page 243. There are a couple of them, and Emend is the first one listed. It helps also to reduce nausea and vomiting and hopefully prevent it from cancer chemotherapy, which can be really severe, of course, and from, once again, that surgical nausea and vomiting that some people have. Side effects are fatigue, diarrhea, headache, and dizziness. Adverse effects, of course, more serious. We can have allergic reactions. Sometimes they can cause angioedema, and if you remember back, the angioedema involves swelling of the oral membranes, the lips, the oro and nasopharynx, and can be life-threatening. That's something that needs to be addressed by an emergency room or 911. Respiratory depression in extreme cases, and one of the common side effects or common adverse effects that you'll see, more serious but a little bit more common, is neutropenia. So some of the white blood cells can be decreased. And of course, if somebody's taking this for cancer treatment, we already know that sometimes their white blood cells can be decreased. And so if this runs a risk of also doing that, it could be dangerous to cancer patients. Drug interactions does not interact well with opioid drugs. On page 246, we see some patient and family teaching. Just 4 bullet points. But very important to remember since they do have a few serious side effects. You want to double check the dosages when you use them with chemo drugs. And of course, we know we're double checking dosages anyway. We're triple checking dosages. We're supposed to. Swirl to mix, don't shake. So if it's liquid, you want to just kind of gently swirl it, stir it very gently. Sometimes it'll be combined with steroids, depending on what's going on with the patient. And once again, watch out for that neutropenia. It's in red, so I think it's a pretty safe bet you'll see that again. Next category of drug is the phenothiazines, which I mentioned already. And they're shown in the table on page 244 in your book, and in the text, page 246, where they start talking about that. These also reduce nausea and vomiting by blocking dopamine, which in this case it's particular dopamine receptors, the D2 receptors, in the chemoreceptor trigger zone of the brain. And just generally helps with nausea and vomiting. Very commonly used for a long, long time, even though we have newer drugs. If anybody's ever taken Phenergan before, Phenergan is our prototype drug. Promethazine is what you'll usually see, but Phenergan is the trade name. You know that Phenergan can make you extremely drowsy, very drowsy. And so sometimes they'll use Phenergan as a drug to sort of calm you down, sedate you, and maybe make pain medicines work a little bit better. Along with this can be blurred vision, dizziness, and a dry mouth, because it works with to also block acetylcholine. People on Phenergan are a falls risk. In extreme cases, since it is working on the central nervous system, you can end up with tardive dyskinesia, acute dystonia, so unusual body movements, and in severe cases, neuroleptic malignant syndrome. And if you're not sure what that is, we talked about that back in the, when we talked about antipsychotics. And so you might want to go back and review neuroleptic malignant syndrome. Because they block dopamine, if you're already taking drugs with dopamine, they can sort of clash and cause problems with each other. So for nursing implications and patient and family teaching with the phenothiazines like Phenergan, definitely they're going to cause orthostatic hypotension, drowsiness, and dizziness. So warn your patient, you're going to be sleepy. They need to call for help if they're in the clinical setting. Don't use alcohol when taking this drug. Hopefully, if somebody's going to be nauseated and vomiting, they're not drinking anyway, but because it's so sedating, another central nervous system suppressant is not going to do well. Watch for Parkinson's-like symptoms, like we talked, tardive dyskinesia. Watch for sudden increase in temperature that could indicate neuroleptic malignant syndrome. And remember that there is now a strict facility protocol when given IV. When I first started nursing, we just shot Phenergan right, left, and center. IV push, no particular restrictions. Unfortunately, that has not worked out well. You can Google tissue necrosis from Phenergan. So that is no longer acceptable. The pictures are horrible. So now Phenergan, if given IV, it has to be diluted in normal saline and hung over at least a 30-minute period. You can also give Phenergan IM, and it's in suppository form, and you can take it PO. It stings. It's a very irritating medicine. And so I'm glad that we're not just giving it IV push anymore.